Hi, I am Dr. Daniela Steyn. I look forward to seeing you in my clinic. I'm recording this video for you while you're waiting for your appointment to help you get the best of your appointment. I really look forward to seeing you. I'm a medical doctor at the Oakville Hospital. I'm a professor at McMaster University. I'm absolutely passionate about your health. I want you to live your best life. I started our wellness clinic here at the Oakville Hospital to help people really thrive through life. I want you to live till you're 104 years old, and I want you to live strong with vigor. I don't want you to have any illness. I did further training in lifestyle medicine, functional medicine, through all the research, everything that's out there to help you to prevent disease. My spectrum is not only giving medication after you have disease, although I was conventionally trained in that. I have my fellowship through the College of Family Physicians of Canada. I did further training in hospital medicine at Harvard. I did further training through the Menopause Society. I did so much training. I'm double board certified through the American Board of Lifestyle Medicine, because I want you to live your best life, and I'll help you. We'll combine preventative medicine, food as medicine, and Western medicine, medication, to help you live your best life. So while you're waiting to see me, please make sure you fill out your intake questionnaire as good as you can. We have a whole team here who's going to help you. And the day or two before your visit, we're going to go through your entire questionnaire, everything from birth, everything you can tell us, medication that you're on, supplements, how often you work out, what's happening in your mind, your relationships. The better I get to know you, the better plan I can establish to help you live your best life. So what to expect? When you see me, I will always go through the 6 pillars of lifestyle medicine. We're going to look at everything. I'll look at your medical history, I'll look at your nutrition, I'll look at your relationships. I want to know how you eat. Your food is very important, and we'll help you with a personalized nutrition plan that will help you prevent diabetes, prevent dementia, balance your hormones. That is a very big component of what we do here. I work with registered nutritionists. Another big thing we're going to look at is movement. How do you move your body? We say smoking or sitting is the new smoking. So in the old days, when new smoking was bad for you, now we often don't know how bad sitting is for us. So we're really going to look at movement, how you move your body, how much. I do have a lot of triathlon athletes. I do Ironman triathlon myself. I do it competitively for Canada World Championships triathlon. So a lot of my patients actually move their bodies too much, are working too hard, or people who come to my clinic would typically be very driven, type A, C-suite, CFO, CEO, president of big companies. And typically these women would be up every morning, 5 o'clock on their Peloton. Quite often, these are the people that I say, no, cut back on your exercise. You're maybe driving your body too much, but it's so personalized. So we look at your nutrition. We look at your movement for your body. We look at your sleep. For sleep, it's not just the amount of hours on bed, but your quality of sleep. Do you get good, deep quality of sleep? And we'll track your sleep, and we'll help you improve your quality of sleep. I've been very successful helping people without medication through cognitive behavioral therapy. When you do wake up at night, how to go into your deep, restful stages. Because my waiting list is so long, I have more doctors now helping me with cognitive behavioral therapy. That's OHIP covered, to help you go into your deep, restful stages. We also have counselors and psychologists that your private insurance most likely will pay to help you with this. And the next one we look at is deep relaxation. If you're in a very driven world, in a driven job, you have a lot of demands on you. And that's everyone who really walks through these doors. Even if you're a stay-at-home mom, you have unprecedented amounts of stress on your body that we're not used to. I didn't believe that we were designed to have access to the news and war and everything 24/7. So we'll look at how you help your body to relax. Every time you're a little bit stressed, your body secretes adrenaline and cortisol that stimulates your sympathetic nervous system. That's when you go into overdrive over the long run. You can get adrenal fatigue where your cortisol levels, when we test it, just flatlines. So we will look at ways that you can access your parasympathetic nervous system through deep breathing, meditation, ecotherapy, going for walks through the trees. What are the things you can do to counter that, to stimulate your parasympathetic nervous system that will help you to kill off cancer cells, dementia cells, heart disease, your risk for stroke. So that's quite important. Deep rest. Another thing we look at is how to avoid toxins. Toxins is big. Quite often it's easy. Alcohol, drugs, sleeping pills. Even if you're used to having a glass of wine every night to just wind down, we now know that alcohol really drives inflammation and it drives cancer. That's why our Canadian guidelines actually changed, that women should really not have more than 2 drinks per week. I know quite often in hospital where I work, if I admit a woman with liver cancer or liver failure, women would often be surprised and say, but I'm only having half a glass of wine every night with dinner. And it could be that for your body, that is too much. And a very interesting thing happens as soon as my patients go through menopause or in the perimenopausal years. Even if you could tolerate a glass of wine every night, then something happens and suddenly you don't go into your deep sleep, or you can't burn fat when you've had alcohol. And we see it time and again. We have a very successful weight loss clinic. We are 100% successful. All our patients lose weight, keep it off. But we've seen with them, if you just have a drink or two of alcohol over the weekend, it really stalls your weight loss for a week before you lose weight again. And then same with sleep after menopause. For some reason, if you have a glass of wine, you'll wake up or you'll fall asleep easily, but you'll wake up 3 o'clock in the morning, be wide awake, not know why. And it's okay if you know it. If you know you're going to be awake 3 o'clock in the morning and it's still, like for example, tonight we have a big celebration. 4 of my friends are hosting their 40th birthday together. So maybe I'll have a glass of champagne, but then I won't be surprised if I wake up tomorrow morning, 3 o'clock, and think, oh my goodness, what is happening? I will know, oh, it's a glass of wine. I'll just go into a deep meditative state and get that rest for my body. So avoiding toxins is important. That would include obviously smoking, drugs, cocaine, methamphetamines. A big part is toxins that we're exposed to. And that we'll discuss more on a case-to-case basis, but that is part of the reason why young girls are having such a hard time falling pregnant, why we have such a harder time going through menopause than our mothers did. It's just because of the environmental toxins that we're exposed to. A lot of our face creams and products we use go and sit on your body. We call them endocrine disruptors. It means it's a substance that looks like a hormone, goes and sit on your hormone receptors, but it's not a hormone. So it blocks that receptor, but it's not giving you the benefit of estrogen. It just go and block those estrogen receptors. We call that endocrine disruptors. Because of that, we developed our own clean skincare line that is medically active, that helps you to reverse sunspots and reverse signs of aging. It's incredibly effective. It takes fine lines away. It really helps you get that youthful glow in your face without all the carcinogens, without hormone disrupting agents. I really recommend you have a look at mddermaesthetics.com and you book with one of our skincare specialists, Dr. Uden or Praveshni, everything for skincare. That's a different topic. But that is quite helpful when we really want to tease down why are women having a hard time balancing their hormones or why they're having a hard time losing weight. We always go back and we look at your hormones. That's quite big. And then so really avoiding toxins, there's different apps you can look. I recommend you go to environmentalworkinggroup.org, EWG.org, and really look at all your products that you use. Is it harmful to you and your family? And then the last one is social connections. Social connections is really huge. It's literally one of our pillars of health. So when people see us for weight loss or for menopause, we quite often connect you to a community of other women. We have lots of events, menopause events, where you can connect with other women. People find that very helpful to be part of a tribe. And then they've done big studies for social isolation. One study was specifically done on nurses who had breast cancer, and they followed these nurses over a long period of time and found that the ones who had more friends or more socially connected had less recurrence of breast cancer, less likely to die from it, whereas women who were more socially isolated had recurrence quicker and died from breast cancer quicker. Another very big study that was done in Sweden looked at men, where social isolation was their second biggest risk factor to die from heart disease. That is absolutely fascinating. So your biggest risk of dying from a heart attack for a man was if you're smoking. But the second biggest risk factor, more than high cholesterol, more than if your dad had a heart attack at 40, bigger risk factor than drinking or not being active or high blood pressure, diabetes, bigger risk factor was very interestingly when people were socially isolated. That's very interesting. So that's a big one. And then so whatever you come to me, whether you come to balance your hormones, for menopause, for weight loss, I will always look at these 6 pillars of health, and I'll address them according to the American Board of Lifestyle Medicine, and I'll write a note back to your doctor with a plan for you to follow the next year. And I guarantee if you follow the plan that I give you and your family doctor, you will reach your health goals. You will lose weight. You'll balance your hormones. However, I know it's tricky. I know it is very hard. Quite often we are the cheerleader for our spouses, for our children, for our parents, but we don't have a cheerleader for us. And that is the reason why I really started this clinic. So through my clinic, you have access to a health coach, a registered nutritionist, marriage counselor, naturopath, a pharmacist, functional medicine provider. But the reason is that I know you need a cheerleader. You need someone to support you, to be in your court. Our clients that are 100% successful, all of them join our membership. That is where they scan everything they eat. They link their watches, their smartwatches. How many steps do you take? What time do you go to bed? What time do you get up? Everything you eat. Then we can easily track. Your health coach can in real time track and say, you know what? You've been having Greek yogurt for 2 weeks every day, and that really slowed down your progress. How about we try for you to go without it and see if we can speed up your weight loss? Or we say, how about you go to bed every night earlier? And that's really where personalized medicine comes in. We don't have a one solution for everyone. There are certain things that's helpful, and because our waiting list is so long, because we are so popular, I'm trying to be able to give this to everyone for free. I have a YouTube channel that you can look at videos. I have a podcast that you can listen to, a lot of blogs on my website, things that you can implement in your own life to help you live your best life. And that was really the heart of writing my book. So let's delve into menopause a bit. If you are coming to see me regarding menopause, welcome. I'm going to help you live your best life. You'll be midlife through life. Maybe you're going to live to you're 104 years old and you're now at 51, which is the median age of going through menopause. We're going to help you to help the second half of your life be the strongest, most vibrant part of your life. It's an incredible journey that you're in for. I start seeing women typically when they start becoming perimenopausal, which would be the 10 years before, 10 years after. So I'll be seeing you maybe from your 30s or deep into your 60s to start hormone therapy. We now don't have to stop hormone replacement therapy after 5 years. We can continue it. A big question women often ask me is, do I have to go onto hormones? You don't have to. That is really the reason why I wrote this book, Thrive Through Menopause. For the past 20 years in practice, I've had so many patients coming to me and say, I'm having these horrible symptoms, but I don't want on hormones. What else can I do? So everything else that I've been telling people, what to do for hot flushes, what to do for burning tongue, what to do for itchy skin, what to do for brain fog, what to do for decrease in libido, all of that is in this book. It's easily available on Amazon. You can read it while you're waiting to see me. I have a lot of YouTube videos, podcasts regarding this, everything that can help you live your best life for me, giving hormones is really only 10% of the solution. The other things that I cover in this book would be how you move your body, what you eat. Are you getting enough sleep? Are you doing things that put joy into your life? So that's quite big. You will enjoy this book. It's really been a game changer for many women. And maybe while you're waiting to see me, you find all your answers in here and you don't even have to see me. Because of the weight, I now have a naturopath who's also certified through the North American Menopause Society, who can also prescribe hormones. We work very closely together. I used to have patients who tell me, my naturopath says this, my functional medicine doctor says this, my family doctor says this, my OBGYN says that, what do I do? That's why I have everyone now under the same roof, so we can give you a team approach and make a plan for you, so everyone is on the same page. So really through menopause, we will help you thrive, we'll help you live your best life, we'll do comprehensive testing for you, and then you'll be so happy you came. But while you're waiting, you might enjoy going through this book. To quickly touch on referrals, if your first visit, if you live in Ontario and you do have valid OHIP, your first visit will be covered through OHIP with a referral letter from your doctor. OHIP only pays for one visit every 24 months, and I'll obviously do follow-up. If I start you on medication or do testing, I'll follow up with you. And I'll make a plan for your doctor. And very likely, if I explain to your doctor why I'm putting you on this medication, even if you haven't gone through menopause yet, if you have just perimenopausal symptoms and your doctor's not familiar with menopause, I'll write a nice letter to your doctor why I'm putting you on the medication, the dosage that's right for you, the type that's right for you. And then your doctor might be comfortable following up. I do follow up with some people, depending at the pay structure your doctor has from government. If your doctor is being paid by the government through a family health organization, then your doctor gets paid every year to see you. So they prefer for you not to be seen by other doctors. So then I won't do your follow-ups. Your own doctor will do your follow-ups. If some doctors are paid in such a system that it doesn't make a difference to them, then I'll gladly follow up with you. I do offer concierge medicine to people who have a membership with our health coaches, our nutritionists, and I will follow up with those people who has a private membership with Wellness MD. And then I will also, if you're maybe from out of country, out of province, and you're just flying in to see me, I have a lot of patients who will stay in a hotel the night before, come in for a comprehensive assessment. We will do a body composition analysis, comprehensive testing. We don't guess, we really test your blood work, your microbiome, gut health. We'll test everything to help you get your answers. Then that is for those people who have private pay, out of country, out of province. We have that option as well. You can just check with our team. And then I really recommend, while you're waiting to see me, book with our naturopath, book with our nutritionist, book with our health coaches, start working with them. And then interestingly, the first person that I got for this clinic was a marriage counselor, because quite often people come to me for testosterone or scream cream for their libido. And then as I'm talking to them, I'm like, oh my goodness, it is not, your problem is not hormones, your problem is more the relationship. And that might help just addressing your relationship to increase your libido or increase intimacy in a relationship. So really have a look at the other services we offer. If you are working with a team, logging, and you're on a membership, even if you're still on the waiting list, I will really try to see you. So quite often a nutritionist will tell me, I'm working with someone, they're not seeing the weight loss, just can you give thyroid medication? Can you do this? And then I'll really, after hours, just get to you to help you address that concern if you are working with the team. Our weight loss program is fantastic. We have a 100% success rate with our weight loss. A lot of our patients, we developed this here at Wellness MD, this protein powder, to help you lose weight, build muscle mass. It helps you stabilize your blood sugar. It's an incredible product. It has fiber in it. It's vegan. It helps to keep you full. This is for some people really that magic ingredient in their weight loss journey. We'll do a body composition analysis for you every week or every 2 weeks to help track how you increase your muscle mass, decrease your fat mass. We will give you whatever you need, vitamin injections, intravenous vitamins, whatever you need in your journey. You'll work with a registered nutritionist. I do prescribe medication, but I don't offer the medication on its own. I've had people now come in telling me they've been on Ozempic, Mounjaro, Rybelsus, lost the weight and gained it or didn't lose. And I was so surprised because in our clinic, everyone is 100% successful. And as I'm chatting with these patients, I realized the problem is they didn't change their diet. They didn't change their lifestyle. And that's what those medications are really supposed to do. I don't want you to be on that medication for life. I will prescribe it to help you jumpstart your journey, get to your goal weight, maybe maintain your goal weight. But the goal is to just use that to help you implement lifestyle changes. On that lifestyle topic, I have a lot of books I recommend. If you are waiting to see us for our weight loss clinic, I recommend you read Atomic Habits by James Clear. Great book to explain by making small little changes can have a big impact on the long run. Everything starts in your mind. That's why we offer cognitive behavioral therapy to people. If you've had a hard time losing weight your whole life and you've been on diets, it's quite likely because there's something happening in your mind. Every time you need a warm hug, you might eat something. Or if you are bored, that's why I eat when I'm bored out of my head. I just eat. So it really helps to understand why we eat. What is our association? Is it for nourishment? How are we nurturing our bodies? So our weight loss program is very successful. If you are waiting to see me, while you're waiting, start working with our nutritionist. Start working with someone, and we try to offer these protein powders exclusively for our weight loss clients. It's made in Canada. This will be the best thing you've done to invest in your own health. And keep us in the loop. Email us. We really want to journey with you, partner with you. When you come for your visit, you might not find parking at our closest parking lot. So there's always parking in our medical tower building at the hospital. You can park there and just walk over the road to us. We're on the second floor. We'll give you some herbal tea or coffee. We'll make you feel very welcome. We'll give you really a high-end Four Seasons experience at our clinic. We want you to live your best life. We will support you in every way we can. Thank you so much for allowing us to be part of this journey. I'm here for you. We are 15 people on our team now to help support you, and we are growing our team to help serve more people so that everyone can experience the same success. We're rooting for you. I look forward to meeting you.